You've been looking at acute lymphoblastic leukemia and particularly a new treatment. What did you decide to do and what were the big issues here?
So we decided to test if the addition of Rituximab, which is a brown old drug, may improve the outcome of patients with acute lymphoblastic leukemia of the B-cell lineage, Ph negative disease. And that's to answer this question, we randomized the addition of Rituximab to the standard chemotherapy in a 1:1 ratio, and we demonstrated that patients who received the Rituximab had an improved outcome. The primary endpoint was event-free survival, and this was significantly improved by the addition of Rituximab.
Right, now these particular patients with who are CD20 positive and Philadelphia chromosome negative, what would they have been treated with if you didn't add Rituximab?
They would have received the standard chemotherapy, which is the standard now is to use a dose-intensified regimen inspired by the pediatric regimen that are translated for adult patients. And some of those patients, based on their criteria of risk, are offered allogeneic stem cell transplantation in first remission.
Now, you had freedom from disease. You also had an improvement in overall survival. What are the numbers that came out of this?
So overall survival is around 60%, which is a good result. Actually, the benefit in terms of overall survival was only observed significantly at a statistical point of view for patients who were not transplanted in first remission with an allogeneic donor. When we analyzed the whole population, including the transplanted and non-transplanted, this benefit appeared only as a statistical tendency.
What was the benefit in terms of event-free survival then?
Oh, the gain was from 52 to 65% at 2 years.
Right, so what are the clinical implications of your findings, would you say?
I think that Rituximab, in addition to chemotherapy, become a new standard of care for these patients who express CD20 at diagnosis.
Would you recommend the use of Rituximab now, or should there be further approval?
No, I think they can use it now based on our experience and past experiences from other groups in control study with historical controls, but not randomization. Here we bring the randomized study that I believe brings sufficient information to add this antibody to upfront therapy of these patients. Although some specific points needs to further be studied, such as the definition of the optimal dose schedule, the relationships with allogeneic stem cell transplantation in first remission, and other points that will be further studied.
So the take-home message for doctors is what?
Add Rituximab to CD20 positive B-cell ALL in adults.